What does it take to be a successful entrepreneur? A dangerous amount of coffee and a ton of grit. My name is Jason Tracy, and every week I interview business leaders to share their stories, life lessons, failures, and advice with you. Welcome to Coffee and Grit. What is up? What is up? What is up? Welcome back to another episode of Coffee and Grit. I'm excited, and I know I say every week I've got a difference maker, but legit, there is a difference maker sitting across from me today. I'm super excited. You know, this is back. It's hard to imagine now as there's snow on the trees, but there was a warmer month back, probably like August, and I got a chance to meet with our guest today, Kristina, or their husband Steven, and he had reached out to me because he had seen an episode with Dan Oginski, and we were able to connect through that. And he was like, "I have a perfect guest for you." And so we started talking, and we were talking about sales and having some good sales talk. And I'm like, "So is that guest you?" And he's like, "No, my wife. And you got to hear the story." And he starts telling me a little bit about Kristina. And then a few weeks ago, we had a chance to sit down, and I'm just so excited to dive into this, talk about Kristina, talk about the difference that she's making in the world, because it is a huge difference. So Kristina, welcome to the studio. Welcome to Coffee and Grit.
Thank you. Thanks for having me.
My absolute pleasure. So tell me, what is the name of your company, and what do you do?
The name of the company is Combat Collaborations, and I am a mental health provider. I'm a licensed professional counselor. I actually trained in clinical psychology and then an additional education in counseling psychology. There's just a few differences there. And truly the difference for me going back and getting the clinical and then adding on the counseling was so that I could go out on my own and create my own business. And the reason I did that was truly because I realized there was a need. I was going to have to do that in order to serve the clients that I was hoping to work with. And I mention that because for years and years, I was involved in the educational setting. I started teaching in college. I taught some high school courses. I went back and taught college courses, and I was always in the health science fields, and I loved that process. I loved teaching those science courses, and I understood the idea of wellness and health and teaching prevention measures. And through the course of that opportunity, I became connected in different realms, even in ministry realms, and started doing speaking engagements, and absolutely loved that opportunity to speak with people and have an opportunity to connect with them and bring them sources of hope and healing. And it was in that realm where I was encouraged to take that speaking further and go into more of a professional role with that, which led me out of education and more into a speaking role. And looking back now, just realizing how all these dots connected, I myself was surprised that I would go from that step into a speaking realm, which then led me back out and into a classroom to become a student so that I could then further go into now what's clinical work. And I really never imagined I would be in this place, but now that I am there and see the need for serving and seeing an underpopulated source of need that's really not getting the attention that is required, I see a need for that to grow. So now I feel like that is my place of service and ministering to other people. And that's what I'm doing now.
I love that. And so what was that? As you're out, because you're speaking, it sounds like you're having success with that. What leads you back into that classroom?
The biggest pull for me is I was always interested and felt led towards helping people in pain. It just felt like this sense where anytime I would do some writing or material of my own to share, it was always drawn to trying to find a place of hope and healing for people experiencing pain. And as a speaker, I was being dressed and called to come in and provide more of an entertainment speaking. Come in and entertain us and speak a message that's enjoyable, which wasn't a problem, and I enjoyed doing it, but I felt like I was missing an area that felt like I was really being drawn towards. And when I would share that message, I personally thought at the time helping people in pain meant emotional pain. Maybe dealing with some trauma from their past, living through hard things. I think we all grow up with hard things. I lived through hard things. Most of the time we grow up and we just don't talk about those hard things. So we just press through and press on. And we all love those messages. And yet I could see that there was a need for individuals that I might have experienced in my growing up years, or even in my own family, or in families that I have known, that they may not have found their source of hope in a conference I was speaking at. So I kept looking at wanting to find ways to address that notion, and I got connected with the Speaking Bureau. They called me in, they invited me in, and that's when I was told I need to establish a platform. You need to have this following, and it really became more about getting that attention, and it was drawing me further away from what I felt like the purpose or the mission was. Who wants to sit and be entertained by stories of pain? That's not enjoyable. And yet it's so real to people's lives.
And even if it's enjoyable, like say you have a room full of people in pain, they may have that hour of entertainment value, but then they go right back to whatever that pain is when they leave.
Exactly. And that is such a significant area. So when I realized that I still wanted to meet that mission, I just truly felt inadequate to think that my thoughts alone would be enough to help someone out of that pain. So I decided I need to know what professionals would do in that situation. When I was an educator, I was the teacher who students would come sneaking in before school, at lunch, after school, knocking on the door with a lot of life hardships, looking for help. And I always wanted to help them. But I would often say, I am not a professional. I'm not trained in that way. And I would try to find professionals, and that was hard to do even in that level. So when I stepped into this realm, I decided if I'm going to pursue this passion area, and I truly thought that's what it was, preparation for speaking. I stepped out and realized I'm going to go back to school. And it was my husband's inspiration to go back into the classroom. I had already been through that process, graduate school degrees. I didn't think I would be going back into that realm at that phase of our life, but I knew that I didn't feel equipped on my own. So I returned back and got an additional advanced degree in psychology so that I would have the merit and understanding of intervention to try to pair that into that process.
I love how you would say, I'm not a professional. And it's like, now I'm going to go back and be a professional.
There's such a different place of understanding. And I really did truly believe that there was going to be some interventions that I could learn, that I could address, and then merge that together with what I felt like I was already using and sharing in that role. And I still feel that there is a value in that. In essence, I love to read. I'm an avid reader, going to the bookstores, finding those messages that help and encourage. But I started noticing, because that was a big draw as well, and I was being encouraged to get your platform, write books, sell your material, and people will find you and have you as a speaker. And I noticed that many of those authors were, in fact, working as professional clinicians, recognizing they do know how to help and heal. And yet there's also a large market of individuals who really don't have that training, that are offering words of encouragement. And that can certainly be helpful, but the realm that I have really graduated into now is an area where as I mentioned, I thought it was going to be emotional pain.
Yeah.
And then I started realizing there is something also that's connected to physical pain, and the way that intersects with emotional pain and emotional and spiritual and social and the whole dynamics. And for myself, it was because I did grow up as a child who was sick often, and I started experiencing chronic migraines when I was 13 years old. And it was often an area where we just didn't focus a whole lot about it. It was put it aside. We're meant to just kind of move forward, push past it, don't give it a lot of attention, and that's how you address those issues. And it just became worse, and it grew and expanded. And when I made the decision to go back to graduate school, it was during that time that I became even more sick in ways that I hadn't anticipated becoming sick. And through a whole series of testing and multiple retesting, it was discovered that I had an additional illness that was of an autoimmune disorder. And in that time frame, I realized that this was an area where there was a lot of misunderstanding, and there was a lot of unknowns and uncertainty of what that would mean. And I have since done a lot of research myself, that was in my graduate work, that there are individuals, parents, adults who themselves are looking for answers, recognizing that there is something going on with their physical bodies that's affecting their entire lives. And they too are looking for answers. Sometimes answers come. Sometimes a diagnosis is given. Sometimes that comes with some medication management. Sometimes that comes with a follow-up appointment. You might see your physician twice a year. And in the in-between times, you're now dealing with an entire changed life experience. And that is when I realized my direction of helping people in pain was something not just personal for my own self, but recognizing there's an entire population and a growing population of individuals, specifically with autoimmune conditions, conditions that are not yet identified. It is incredibly common to hear, and you can hear the frustration and the passion and the hurt in individuals who will share that they go to a physician's office sharing new symptoms, parts of their lives that are not typical, and they go through tests and assessments and they get back results that say everything looks to be within normal limits, everything's fine, and they're sent on their way. And they're discouraged and they're frustrated and they don't know what to do. And now they're starting to question when their provider then says, maybe you should talk with somebody in mental health.
Yeah.
And while that is helpful, if we're not careful how we share that message, that leaves the listener with thoughts and beliefs that this is not authentic. This is not a real condition. This is just a matter of how they're experiencing their life or stress in their life.
Empathy keeps popping up, in my head as you talk about this, and I'm thinking about even you talking about growing up and having the headaches from 13. A lot of people, it's like push through it. You got to do, because who else understands what you're going through? I don't think anybody wanted you to suffer, but at the same time, is she just saying that? I'm just kind of assuming things here, but is that kind of like what happens?
That is incredibly common. In fact, it's still happening, and I'm an adult and I'm living with additional issues where there's this notion where it's really uncomfortable for people to talk about things that are painful or things that are unknown or uncertain. And there's so many dynamics there, whether we're talking about the impact that having a change in one's health has towards working in their social realm, whether it's family or friends or their colleagues or social situations, or it's how they might interact or intersect with the healthcare system themselves. And there's such a need for a patient's voice to be valued, to be heard, to be listened to and understood, so that answers can be clarified, so that solutions can even be brought into play. One of the areas that I see repeatedly, and it's the reason why I focus not exclusively, but primarily with patients who are living with chronic physical illness, is that when a diagnosis is finally reached, or perhaps it's not yet been determined, there is a need for continual support throughout the illness. And that is to increase their quality of life. That's to increase the capacity to trust their healthcare system. Unfortunately, right now, these autoimmune conditions is such a growing area, and it's really emphasized in parents of children with these disorders. It is a very long, grueling process of even identifying a diagnosis. Many parents are sharing that it takes years and years and testing and retesting before real answers are found, which leads to mistrust with the system. It leads them to deal with unsupported educational systems and very dismissive friends and family, which leaves them isolated. It leaves them feeling alone, even though they recognize that their child is suffering and they feel helpless and powerless, and they're looking for that ongoing support.
Before we get back at it, a quick shout out for our sponsor, Playbook Builder, powered by AI. This show has always been about giving the resources and the tools to small business owners in order to grow and scale your businesses successfully. And so I'm so excited to partner with a company that does just that. If you've listened and heard any of our guests, you've heard talking about building process, developing and training, building culture, are all such important pieces in order to building a great company. Well, Playbook Builder, powered by AI, has come along and revolutionize the game on how you can do that for your team and people, whether you're onboarding new people, training and developing, continued training and developing, you're looking to scale your business or eventually sell, or most importantly, you're looking to build a legacy as a visionary. Playbook Builder, powered by AI, is able to solve those problems for you. For me as a consultant, I've been able to plug in, and it's so amazing for what I do for clients. I can now leave a legacy. And so, for example, I'm next week training a new hire for a company, and I've been able to build out the next month of her training program using Playbook Builder, powered by AI. The cool thing about the AI, what does that do? What's the hardest part of building out a process? taking the step by step and making it easy to learn. What the AI piece does is you can actually type in what process it is, whether you want to onboard, if you want to onboard a new employee, type in onboard a new employee and what type of industry you're in, and the AI will put together a foundation for you to build out your playbook. It is absolutely incredible. But don't take my word for it. Head on over to playbookbuilder.com, and these guys have set it up to where you can take this for a test run with no obligations. Plug in what kind of playbook you want to build. If it's a sales training playbook, for example, plug that in the description. And in the description, you can also put in what kind of industry you're in, and then hit generate, and it will generate a playbook for you. Impressed from there, and you can take a 30-day free trial of the playbook system altogether. Something really powerful when you're telling me your story is, talking about getting ready for the doctor and having to take your husband in just so they would listen to you. So you'd have somebody that would validate the things that you'd have to do to prep to get ready.
That is such a really challenging area. And I hear this routinely. When I was mentioning just that notion of how do we interact with the healthcare system and have that sense of value? There's such a thing as a patient role, it's called, and we tend to fall into it. We want to be good patients. We want to be thought of as being cooperative. We want to be thought of as being compliant. We know that our interaction with them is what leads to a better feeling of being heard and understood. And so many times, myself included, I can't tell you how we go in feeling the need to keep our feelings and our emotions in check. Even though to describe the pain and to describe the symptoms and describe the impact it's having on our functionality is really hard. But if we become too emotional, or if we express an emotion that others would say, well, that would make sense, it comes across as being an extreme overreaction. It becomes a situation where now the concerns are that perhaps this is more of an anxiety issue, or this is related to something else in their life rather than a physical health issue. And it just draws my attention to, I have a very, very dear former client. She just recently passed away, and she would share that she would end up in the emergency room frequently. And if she showed up and was having severe challenges with her heart rhythms, and if she showed up into the ER and she was sharing how frightened she was, it was quickly dismissed as anxiety and she was ushered out. And so she would go in and try very hard not to be afraid and not to express emotion and try to keep things shut down. And I just hearing her share that and realizing that I myself go into appointments. Even now, I go in feeling armed, I'm prepared, I'm ready, I have my script I've rehearsed in my head, because I feel like when I'm sharing, it comes across as it's not credible. So many of us are saying we have to have companions with us in our appointments. We have to have a spouse. We have to have someone there to validate that what we're experiencing is real. It's not an overreaction, and it's not a intermittent experience. It's consistent. It's persistent, and many times it's progressing. And to feel like we can't be taken serious or even be heard as credible, that's just a whole different level of mistrust within that system.
And it makes so much sense anyways, but then we talk about this, and I love that we're talking about this, because I think it's eye-opening, one, but I think as much as it's eye-opening, we know it exists. When you were talking about it like that, I was sharing with you how my mom was going to the doctor. My stepdad is diagnosed with cancer and had been given 6 months, and every time she goes to a doctor, she gets a different answer. And when she asks questions, it's like she's kind of a pain, or, she feels like burdened, or, and it's, so this all like kind of makes sense. But then you were telling me about how, if you refuse something, or if you know that something's not good for you, and if you refuse it, then they document that you're resistant.
Yes, that whole notion of being compliant.
Compliant, that's the word.
Non-compliant. And oftentimes it's just a checkbox. And I even see it on my side of things when I'm working with clients, if they're following the recommendations. And yet, again, to be able to stop and listen and hear why someone might not have been compliant. And I'm hearing routinely when they're having side effects from medications, when they're seeing long-term consequences. Many of the medications, yes, they treat some symptoms, but they also bring on other concerns, long-term concerns, cognitive decline concerns of this may increase your risk of developing things like dementia or Alzheimer's. Well, when you hear those concerns, those are very valid. That's not someone being emotional. That's not someone being overreactive. So exactly to your point, part of that, the patient role that we often see is a patient will fall into not wanting to ask too many questions because it makes it look like you're going in, trying to take over or look as if you've already seen Dr. Google and you know what you're showing up for. And yet the notion is there are questions and there are fears. And if a provider just sits and listens to the patient's voice long enough, they will hear the fear that's behind the non-compliance. That's an area of being able to address the concerns and even look at the compromise. Quality of life matters. And if somebody is going to be in a position to choose to follow a recommendation, because it brings them a greater sense of peace, then that's the comfort and the healing that they're looking for, rather than looking as if now the checkbox is that they're a difficult patient. And as you mentioned, putting a team together, it is a team. I often will laugh about, I have a primary care physician. I see that person once every several years, if at best. The last time that I went, the physician thought that I was a new patient. Oh no, you've known me for 10 years, and was convinced. Are you sure we've met? Because I don't see primary cares. I see specialists, and I have a number of them, and they're referring to others along the process because it is a team effort to try to really treat the whole patient. And that's where lies that interest on my part to be part of that team experience, and from the mental, emotional, spiritual, social component as well as part of the treatment option. And the interest on my part in being in what's called collaborative care truly is to provide that team experience and to allow patients to recognize if a mental health care provider is brought into your team, it's not to suggest that you caused this, that this is all in your head, that you're making this up, that this is just you over-exaggerating, or even worse, patients feeling like they're seen as they're just trying to get attention, that they are not able to cope with everyday life, where many of them are working and functioning and living life as they typically would, but they're doing so isolated, in pain, and feeling afraid to ask for more support. And that has to change.
It is pretty insane when you think about the people that are just what they're living through and what they're accomplishing throughout their day. I have a friend who suffers severe headaches, and she accomplishes so much. She's incredible at what she does. And it's like, and she's doing that every day in a chronic pain. That is insanity.
The chronic pain and this chronic pain that we are seeing across the board. There are a number of concerns right now, especially with patients who have in the past perhaps been treated with pain medications. We know that we as a culture are looking differently at that problem. And so I am seeing an increasing number of calls coming in from providers and patients alike saying, I need help with managing pain without the use of these medications. Or in some situations, they're not given medications and they don't know how to cope or tolerate with the high levels of pain that are part of their everyday experience. And even that becomes a complication in terms of having the right amount of support. And for myself, I am very upfront, and I share this from day one. I am a part of that collaborative team, but I cannot, in my work, guarantee there's going to be a cure, that I can take that physical pain away. I wish that I could. I wish I could take my own away. Most of the days when I'm working with patients, I'm at a high level of pain myself, and I'm experiencing symptoms right along with them. And part of that is knowing that experience from firsthand is, I think, just a different level of passion. I think that's probably why I was drawn in the first place, that there is a place of need for people in pain. And I mention this because it's, I was trained by reading textbooks, and I learned the material right alongside all the rest of my cohorts, and they're doing remarkable work as well. But many of them are focused in different avenues of interest. And I felt like I was kind of off on my own in this little ancillary group of, I'm working with people with physical pain. Well, what does that mean? Doesn't everybody, but no, it's not the same experience. Anyone who's ever had a bad flu or ever got sick enough that they were home for a day or extended period of time from work or had surgery, they know what it's like to take time off, to heal, to get better, and to get back into life. People who are diagnosed with chronic illness, they are told in their appointments, there is no cure. We're going to do the best we can to manage this, but this is now your new way of life. And that is an incredibly hard thing to hear. And to hear that, it's natural and normal to be afraid, to feel sad, to have loss, the before and after. That means parts of your preferences, your lifestyle, your interactions, that is a drastic change. And that requires so much processing of that ongoing loss and that transitional loss. And that part is never achieved. It's continual as the conditions progress or they worsen or the medications create complications. And again, that's that need for that ongoing support that has a lot more to do with you're not doing this alone.
Why are we so like, I mean, we get really caught up. We got to treat our body, right? We end with that. You know, there's such a stigma around therapy. There's such a stigma around all this piece. It's to the point where it's not even the first suggestion. You're going to die or you have this chronic disease. Go deal with it like to by yourself because nobody else understands what you're going through.
That whole stigma piece, it is gaining a little more traction now, but even more so, we have to be so cautious that because it's gained enough traction that it's found its way and kind of infiltrated a lot of social media. There's a lot of information out there that's circulating that's not actually, from an intervention standpoint, accurate or truthful. But there is at least now a growing awareness that this is a part of our mental health, our emotional health, our physical health. I don't understand the reason why. And in my former life as an educator, I used to teach physiology, so I know how the body's designed and how it works, and I was always fascinated by that. So to think that we would somehow separate the brain, the mind, how that impacts the rest of the body, and then have this judgmental tone towards it that prevents individuals from actually truly getting the help that's needed or the support that's required. It really doesn't correspond to that notion of how we work as a society and why that's still delaying, but it is. There's still a tremendous need for that to be clarified.
And it's having that support. You know, it's having the doctor, the therapist, like having the pieces of. I have a client and she calls it the legs to her table. She has 4 autoimmune diseases and she turned to substances and she became an addict. And then now she's climbed out and she's helping other people. And she calls it, I had to have the legs to my table. I had to have a community I had to have a doctor. I had to have these people that I turn to in order to support me when my finances are going bad. I need to have somebody that knows what's going on and has my back.
And that support, that is such an area that is also struggling, that I belong to some support groups myself, some forums as well, and I keep track on some of those conversations that I'm seeing in between individuals. And one of the common themes, and it's so sad to see that this is happening, and I don't just look at it from a distance, I know it in my own life, that as soon as someone gets sick, we're really good initially at taking care of somebody when there's a major life change. We might show up with a casserole or a meal train, as it's called.
Yep.
So for that first week home, there might be some support. And then after that, it tends to kind of dwindle down. Or we might be good about sending those balloons or cards that say, get well soon. And something about that phrasing is very hurtful when we all want to get well. And we want to get well soon. And we're told that there is no well. What does well look like now?
Yeah.
And how does a life transition in that way? And the invitations for socializing, the opportunities to stay involved, that starts to dwindle down. And that's one of the areas I hear so often is even patients are saying, I don't know who to ask for help. I don't want to share or overshare. I'm afraid if I tell somebody what it's really like, I'm going to be typecast as the downer. I'm going to be the one that nobody wants to engage with. So the majority will say, I just might tell them a little white lie. They'll ask how I'm doing, and I'll say, I'm doing okay. And then they seem fine with that question. And there's really not a follow-up of, no, really, what are you really experiencing right now? How's it going? How can you be fine? What are you finding that's helping you to kind of re-enter life as you once had? How's that impacting your dreams for your present and your future? And those are conversations that many will say that they have to either keep that information to themselves or they have to go into these forums because they have a hard time finding people who truly get it and understand what it's like to wake up every single day and to have that initial thought and awareness that that pain is still there, that symptom is still there, and they have to make a choice that day how I am going to perform and get through today's tasks without people understanding or even supporting it or even believing them, which is one of the harder parts.
I think this is so well timed as we go into the holiday season. As you're talking about, I know I'm going to share that clip because I think that is just so powerful. We're family. right? And to be able to really care, knowing whether it's your mom, your sister, your, whoever, they can't be good. They can't be okay. Let's talk about it.
Yeah, the holidays, oh my goodness. Even for myself, it was such a shocking discovery. One of the areas that I have struggled with because of I'm going to say this as one of my autoimmunes, because once you have one, you tend to find a partner. And so now I have a variety. And yet for me, the change in lifestyle when it comes to food selections, I have a highly restricted diet now. And it's not by choice. We have this stigma around, even like, an allergy, or you're picky. And when it's about life or death, it's not picky, it's survival. And it's educated and it's smart. And yet to show up at a family gathering, the amount of personal losses a person experiences, and we like to call them like having multiple little funerals throughout the day, and how exhausting that is to show up, all of the traditions, all of the favorites. You can't participate in those anymore. And yet the people around you, you're not asking them to now be without also, but that just the awareness that you can show up for a meal. And it became noticeable to my husband at a major holiday dinner when I walked through the line, just like everyone else, and I tend to be on a quiet side when it comes to that stuff, that I sat down and I had a banana and one little slice of cheese on my plate, because I realized in that moment there was nothing. Not a item I could choose safely to eat. And that was that one time I had forgotten to bring food with me. I had to become really creative and have meals on wheels, I called it, and I'd have to bring it myself. And just the level of preparation, if you think about what does it take to just go out for an afternoon, go for an outing, go for a picnic, go to a family gathering, get together with friends. You're constantly thinking about 3, 4, 5 steps ahead, because you can't just engage as usual. To go out to a restaurant and there's few, if any, item on the list that you can choose from. So it really complicates that. So when you go into the holidays and you have to create new special traditions, which I have found I can embrace a lot of those new areas. And that's an area that I have to help a lot of people to find those joys. But when your family doesn't notice it, and it's not because they're not wanting to be caring.
Yeah.
It's that noticing just that different level of awareness and being mindful that there is a level of loss and sorrow. And how do we support that without making someone feel bad or feel like they're being difficult because they need a few extra items added to the menu?
If you're telling, I remember you talking about bringing your meals on wheels and somebody saying, "Did you bring enough for everybody, or can I get some of that?" You're like, okay.
So we still joke about that because that's such a commonality, thinking, we bring a dish to pass, not knowing that for the first year after I was diagnosed with my one autoimmune disorder, I had to work full time just to prepare meals, because almost nothing I could eat was on a prepared list. If you went into the grocery store, there were few to zero items that were safe. So I was cooking and making food from scratch
every time.
24/7. It was full time. So if I prepared something and showed up with it, that item was going to last me several days, honestly, and in multiple meals. I didn't have variety. It was the same thing over and over again. And yet I was grateful to have it. I often talk about, for me, gratitude was the form of a fork. And there's a whole group out there. They're called the Spoonies. They're a wonderful support network for individuals with chronic illnesses who they use the reference of a spoon. It's allowing people to have a different visual symbol image of what it means to have a chronic fatigue issue that shows up when our physical bodies are taxed and we run out of allocation of energy. So they call it the spoon theory. And for me, I thought that was so unique because I always saw a fork as a source of gratitude. And the reason for that is because I would go through different steps of healing where for a while there was no consuming of food, and then it may have graduated to something I could consume through a straw, and then it may have progressed to a spoon. That if I could eat anything with a fork, I was so grateful to have the opportunity to consume food with a fork, but to just know that there is such a progression. That's not a sign of someone being picky.
Yeah.
That is a sign of someone who has had to work really hard to get to that level of acceptance of where they were. And they're continuing to work in that level. So that, again, it's that awareness piece that, no, I didn't bring enough for everyone. In fact, I don't even have enough for myself. But those are those moments of just recognizing who in your family has had to experience a life transition, whether it's through illness, whether it's through aging, whether it's through the development of a diagnosis is dangerous. You mentioned cancer. I don't know if any of us know anyone whose family hasn't been impacted by a significant diagnosis, and it impacts the whole family, and it impacts every aspect of their life, and it's hard. And finding the supports for everyone involved is a big part of where my contribution to the team is where that support can come from. Oftentimes, patients are treated by the physician, but not the patient's family members. So in my practice, I can offer family therapy. I can offer marriage and couples therapy to help them navigate the change and the progression of change together. And that's part of that support network that can help individuals learn how to tolerate stress and start to make new dreams for their present and their future, because that is not always met in other areas of healthcare.
So we've talked so much about really that empathy, and then like being able to understand what is it like? What do people experience when they come and see you?
That is such a great question. And oftentimes I wish we were able to give patients like surveys and what is this experience like for you from that standpoint. It's not part of the field, and there's some really good reasons why that's in place. But I'll tell you the one area that just has stood out for me, and it's the reason why I'm still in this work. If you recall, I meant to do the training so that I could write material and I could speak. And I realized that in order to use the information meant I had to get into the trenches. And once I got there and looked around, it is so overcrowded and populated. And finally, there's this sense of somebody gets it. I hear that phrase every single day. Oh my gosh, you get it. And it's often in the very first meeting. And it's not because I have special terms or words or strategies. It's because I live it. I know the language. I know that expression when somebody sits down and they try to tell me how tired they are. Tired is one thing. Having fatigue on a whole different level is something entirely different. When I hear a patient or a parent come in and say, my child is able to take a shower, I don't understand why they have to lay down and take a rest after. And I realized for myself, after even taking a shower and realizing, what do you mean I don't have the strength to stand up and use the blow dryer? That's sitting down? That's ridiculous. And yet that was the reality for me for a very long time. You're choosing basic life functioning until you're able to restore. And part of that restoration is coming through this different level of pacing life. In other words, this whole idea of holidays and getting together with family, if there is a gathering, if there's an event, if there's an outdoor activity, maybe there's a socialization, you're playing games, it takes a tremendous amount of focus and energy to be present and enjoy those moments. And for many, the day after is a day that many will say, if I do something fun, I'm punished for it. I'm in so much pain the next day or 2 days, I can't function. So I have to pick and choose. And then they hear those statements, well, you seemed just fine last week. And those notions of, well, you don't look sick. How can you, what do you mean you don't, and it's not about the physical appearance, because so many of us, we are going to put on that mask to try to have any sense of normalcy that we can. Again, we don't want to be labeled as difficult. We don't want to be labeled as an outcast or somebody who's just seeking that unwanted attention. Nobody wants to feel that. So when they walk into the office, you ask, what is it they feel like? They feel like they can finally sit down and they can be themselves and be real, and somebody's going to listen and understand.
And see them.
See them for who and what they really are and what they're going through. And ideally, we would want family members to know how to do that. We would want a spouse to know how to do that. We would want parents to know how to do that for their children so that they too can be sources of support and comfort and encouragement.
How do you have enough time in the day? Because it sounds like you really, we talk about, I love at the beginning, you talked about, I help people in pain, and we're talking about therapy. And I think if people didn't listen to any more than that, they would assume because everybody's in pain. You made that point. Like we've all been through, through these different things, and we're all in pain. There's certain ways to interpret it. And then we get into the conversation that we're having, I had a point to that, but it's like, how do you have enough time in the day to empower the people that you're working with?
For me right now, honestly, that's a big area where I am still learning to try to pace that myself, because I do have quite a lot of referral options right now coming in, and yet there's still a need for people to recognize what that sort of care can be. And what I mean by that is therapy is well known. It's something that people recommend. Physicians recommend that all the time now, and that's a good thing. The collaborative approach, however, is to not suggest when somebody is showing up in the ER because they're having some excruciating pain that they're met with this notion of, here, you should talk with our mental health clinician, when they're being told that you're just having some anxiety, you just need to calm down. I've had my own experiences where just in exasperation of trying to share my experience, share the details. Here's the timeline. It's well documented with pictures, with details. And I have providers say, okay, let's just calm down now. Let's just calm down. And realizing I've been waiting 8 months for this appointment. Yeah. I called to get in to get help 8 months ago. So I am animated and I am elevated in emotion, because for the last ever many days or months or weeks life has been hard, and there hasn't been improvement, and there's worry and concern, and we're trying to get all that information in very quickly. And yet that notion of, how do you have time to meet all those needs? Well, healthcare providers are in the same boat. They really are trying to provide the best care they can. So that notion of even helping patients learn how to become the better version of themselves as a patient, so that they're not fear-based, but they can go in and feel comfortable and can feel as if they can maintain a sense of dignity. That is such an area that I have felt so passionate about, that there's this notion, on one hand, some might say, oh, just learn to laugh it off. Just use your sense of humor. And there's everyone wants to have a wisecrack about certain symptoms or the experiences people experience going through testing and assessments, etc. And yet, as a patient myself, I would love to change the way in which we conduct ourselves in those medical facilities, the offices, the hospitals, where if we see a patient present, let's give them the space and dignity. They don't need to. I have a personal experience of having been that patient, lying in a bed in an elevator, coming from an assessment, and having someone say, oh, hold the door, and the whole family squeezed in around the bed around me. And I just tried to duck underneath the sheet thinking, did you not notice there's a patient here? And the attendant, providing me transportation back to the room, there was no acknowledgement of, why don't you catch the next one?
Yeah.
And just that level of awareness. Again, can we get past our own comforts, our own agendas? It's not convenient for anyone on the planet to get sick. It's never convenient for someone to hear a fatal diagnosis. It's never comfortable or good timing for someone to hear they have cancer, to hear they have an incurable condition or disease. It interrupts everyone's life. If we could be more mindful and present and notice, because if it hasn't happened to us yet, it's happened to a loved one, and we certainly don't want to look for the day it might happen and hit our home, but it's happening all around us. And we're not noticing, and we need to learn how to notice. And you keep mentioning empathy, and boy, is that a skill that needs to be learned and taught, and our children need to know it, and our teenagers need to know it, and our educators need to practice using that with them as well, because I know I don't have enough time in the day to meet all of those needs and meet my own at the same time to be able to be a good provider.
Yeah.
And yet the need for others to know that there is a place for that help, that is a big part of that passion. And I hope that I'm still walking down that path for the right purpose of helping people in pain, but it's not so that they can be entertained, but now it's so that they can have a new sense of hope for their future.
I know for a fact you are walking down that right path. And it's just the fact that at the beginning, it's, I've always wanted to be a speaker. It was when I started my business, but I always went into these seminars and saw these speakers and saw them as like, and we might have even talked about this, like fake. They're there to entertain. They're not, really their message. And I just saw that over and over again. It was like, when I get out there, I am not going to be that. and I think it's so important. It's you went into this like, I'm going to go become a better speaker. I'm going to go through this whole entire process. But like, have you ever sat back and looked at the signs and even your symptoms getting more intense, that this was really your purpose? Like those signs, as bad as they may have felt, were really pushing you in the direction where you were supposed to be.
I have seen and I have felt that, and I have to sit oftentimes and realize that I think a big part of that, and for me, a big part of that in wholeness, looking at our physical, mental, emotional, and spiritual health, that's for me, that's that spiritual component. And I had heard a message years ago from a well-loved and trusted pastor share a story of a scenario where the shepherd would oftentimes injure the leg of a sheep and then carry that sheep on his shoulders and allow him to rest there while his leg healed. And the purpose for doing that was so that the sheep wouldn't, number one, they wouldn't be able to go anywhere. So they would have to sit there and rest and learn to draw near and to trust the shepherd. And when the healing took place, they would set that sheep down, and the sheep would have grown so close and trusting of the shepherd that it wouldn't wander off anymore. And for myself, I realized, and I even shared it with my speaking bureau, that this notion of develop your platform, I said, I think my platform is going to remain on the shepherd's shoulders. And if that means I'm going to remain unhealthy, and every time I have healing and progress and a new diagnosis shows up, I see that as an indicator that it's okay to stay in this place of brokenness, this place of need, because it keeps me closer to the shepherd, and it keeps me that much more mindful of all the others that are hurting and that are hurt, and that someone needs to notice them. So for me, that's my platform, to be risen up on the shoulders of my Savior. That's powerful enough for me to say that I'm going to stay powerful there. So that's where I feel like, yes. Do I see signs in it? I do. Do I still pray and hope for healing? Absolutely, every day. And I tell my clients I'm praying for them, and I mean it. But I do see there's purpose in that notion of saying, yes, there are people needing to be helped. And as long as I'm in this kind of what I call the trench work, because I'm not afraid to step down in there and hear about the hurt and to see the tears. And that idea of having a comeback doesn't mean that we're going to rise to fame and fortune. It means we fell down and somebody was willing to lend us a hand and just help us get either seated or back on our feet. And there are so many around us that have that and have that need. And I'm just one of them. I always say I'm a member of the group, and I'm just trying to help everyone find somebody to have somebody to hold on to as they too are trying to find some stability in the midst of some really difficult circumstances in life.
That story of the shepherd is the most beautiful way I've ever heard somebody put that their pain is their purpose. Their pain is, because almost every guest that I've had on, and this might be episode 140, somewhere around there. Every guest I've had on has, through their experiences, they've solved a problem or are serving people in some way that they experience pain. They found a solution for their pain or something they experienced, not as intense as what yours may be, but they found that way, and then they found that way they didn't want to go through that. I didn't want to go through the stuff that I went through. But then as I was sitting as a sales leader with salespeople, and I'd sit and I'd be able to listen to their, I'm sitting and having a performance conversation with them, right? Because they're not performing, and they start telling me about their life and how their life's this tragedy, right? And they have these things that they've been hitting, and mine was that way too. And I think there's a big difference between sympathy and empathy. Sympathy would be like, oh, go home, take a nap, like sleep it off. Maybe you'll get better. Like, it's like that pat on the back and, the superficial stuff. Empathy was like, I have been where you're at. And if you go home and take a nap right now, it's not going to get any better. There are some things you can do, but every time I get done talking, people would be like, and I didn't have to say that. People would say, I feel like you've been through, like, as you're listening to me, I feel like you've been through what I've been through. You're listening at a different level, and it's like, I have been through what you've been through. And so I'm telling you this from a place of somebody that's been in your shoes. And it's what made me a successful leader in that. People could come to me. I was approachable. And then when I wasn't just passing them by, because so many people from a leadership sales leader, I want performance, right? Why you're not performing? And I'm looking at it from you're an object versus you're a person who's going through pain, and like, let's listen to that and validate it. You're going through those experiences. What can we do?
Absolutely. And it's, as you just mentioned that, nobody signs up for this.
Yeah.
Nobody would. And often we'll even joke around in the clinic room of, give us multiple choice. 9 out of 10. And no, 10 out of 10 times we choose something other than what we're living with and living through. And that's part of the difference. Many people are walking around right now. They're living with something. They have a diagnosis. They have a label. They have something attached to them. They may have multiple. In fact, I work with a lot of individuals who, when they show up to meet me for the first time, they pull out a list and they have a long list and they have multiple pages of medications they've on. They have a long history. They have a binders, and they mention they have to go into their physician's office that way just to show the trajectory and the long-term process of finding diagnosis. And when I see that, I just recognize just how well they have been trying to manage versus seeing that as something that's become this overfocus, this hypochondriacism that people have talked about in years past, where really, no, there are a lot of symptoms nowadays where people have recognized this has been a problem. It's been a problem for years, and it turns out that it wasn't diagnosed until many decades later. That was the case for myself when I got back into graduate school and they finally had a diagnosis for me. I had been having these symptoms since I was a kid, and it was just always dismissed. It was always given other directions or put into other terms, and finally I had a physician say, "You've been living with this your entire life." When I would detail symptoms, and I thought that was the normal way of life. In all honesty, that's true, and I hear that all the time. People say, doesn't everybody experience that? Isn't that normal? And you find out, that's not normal? People don't actually feel that level of pain? Well, what could that be? Then what do we do about it? And so then we learn the process of coping. But there is that notion of just recognizing, to your point, that there is a level of humanness and normalcy to having that show up. But why do we have to feel the need to either bring judgment or even shame? And in some cases, we even point fingers of causality. And some people will even have comments of, well, this was based on your behavior. And I still experience it even now. If I have a pain, someone might say, what did you eat? Ooh. As if I'm now responsible for the pain.
Yeah.
I didn't choose the pain. I'm having a safe option, but sometimes the body doesn't cooperate. And I hear that from clients all the time. Or even from a spiritual perspective. Well, where is your hidden sin? Where have you not gotten your life back into according to God's word so that you wouldn't have this consequence? And yet, I wonder if we would use those same words if we were walking into a children's hospital. We have to stop and pause.
Like, oh my
God.
What
did you do? And look at your child and look at your, and so again, it causes a lot of people to withdraw from shame, a fear of being judged. So there's a lot of isolation, and there are a lot of pockets of individuals who they truly need that sense of connection and belonging. And having those handoffs, whether it's through their physician or other sources, to know that they really are not alone in this is what's so important to me.
Just to reiterate it again, you don't choose this. You didn't sign up for it and say, yay me, I can come to every holiday and have to bring my own stuff and, just inconvenience everybody.
And that whole word of inconvenience, there is such a strong connection there. I can't tell you how many, and this is a part of, we work on communication skills because so many people are afraid to be honest because they're afraid they're going to burden someone else. Or they know that they have family or friends who also have hard lives, so they're not trying to add to the problem. But in their kindness, we talk about the difference between being nice and being kind. One is a people-pleasing maneuver and the other is being caring. Yeah. And yet when we have to dismiss ourselves out of fear that somebody else's hardship means that they don't have room or space for us, sometimes that's not always the case. So we have to be open and honest and learn how to engage that. Because I can't tell you how many young people are so fearful that their illness, their diagnosis, their life is a burden to those that they love the most or those that they think love them the most. And as soon as that term, I'm a burden to others, comes into play, now we start looking at things where now people feel powerless and people feel hopeless. And that's a real dire concern, and we have to look at that area. So if you have friends or family, if you see that within your own family, we want to start communicating that. When we ask somebody the normal common phrase, we use it at the checkout. So how are you today? And we all say fine. We're fine. Everyone's always fine. Yeah. But the truth is most people aren't fine. And we want to start engaging in conversations. Not all the time. It doesn't have to monopolize the conversation, but if there's never room for it, then it just keeps people just that feeling they have to stay hidden in the shadows because there's something either shameful about it or undesirable about it or unattractive about it. And now there are these many, many, many young individuals I'm working with. Can you imagine teenagers, college-age students, young adults who are saying they're getting diagnosed with diseases and now they're afraid they'll never be able to have a relationship or start a family? When do you disclose such an information? Is someone going to reject me because I have a condition? All of these conversations that cause people to feel so isolated and afraid. And these are those conversations that we can equip them with tools and opportunities to learn how to share truths and how to find those connections and still be valued. A diagnosis doesn't change a person's value, but it certainly can change the way they see themselves or perceive others to see them. And that's where a lot of that work comes into play.
Well, I'm glad you mentioned that too, because there's so many reasons why other people respond the way they do. A lot of it's just they're uncomfortable, or maybe they are dealing with a lot and they don't know how to respond. So they're like, it's that more superficial, like, did you eat this? They want to be helpful. They don't know how to reply. And I think where something like this can be educational, because, as you're saying stuff, like I've thinking about conversations like, oh, I've said that before. Like, oh, did you? And it wasn't from a place of like shaming them, but it was a place of like, I think I'm helpful. I'm asking questions. I don't know. I'm like dialogue, right? But to be able to educate people, like, that's not the way. Like, what would you do?
And that is such an important area because we talk all the time about help that's actually helpful.
Yeah.
And that's again, coming back to that place where the patient's voice has to be valued to hear. And so many patients have been conditioned to even dismiss their own thoughts because they're not the expert. So then they question and they don't know themselves. And we probably have all seen this. And we extend the hand, and it's all meaningful. Please, if you have any need, please reach out, help. I'd love to help, anything you need. And we all say the same thing. Oh, that's so nice. I will. Thank you. And then there's no additional exchange because we don't know what to ask for, or we're afraid to ask for what we might really need because that seems silly or that seems ridiculous. And then the individuals who want to help don't feel like they're being helpful. So there is this void in that area.
It seems like a very superficial thing to say because like, that it's just that thing to give the support, but is someone going to really ask you? Probably not. And you're probably not going to, it's just going to be that thing.
Absolutely. So to even like now around the holidays, I can't tell you how many clients of mine will say to me, I wish people would just check in on me. I don't need them to drop off the meal. And we laugh a lot about casseroles. I don't know why we think society, a casserole. We wouldn't typically make that, but somehow that's what shows up.
Casseroles are never on my dinner list.
We're sick, we're vulnerable, we need to heal, and here's a casserole. And yet when we find
secret healing powers of casserole.
Absolutely, and it hasn't worked yet. We just need to tell people that. But there's this notion of saying, I just want someone to keep checking in. Just please let me know that I haven't been forgotten. Please let me know that even if I have to turn down an invitation, please send it. Please let me know that you're still thinking of me. Even if it's just, hey, had you in mind, how you doing? I'd love to get together sometime. And if the response is, I'm not able, then that's okay. It's not questioned. I had experiences myself where there was this conversation going on. I found out behind the scenes that there was this notion of I just wanted to move on to other friends because I wasn't keeping in touch or reaching out. And the truth of the matter is when I'm in a state where things are hard, I have a tendency to kind of withdraw myself and kind of hunker down and just deal with the things as best I can. Mm-hmm. So we have to be careful how we misinterpret people's cues and just letting people know that we're still thinking of them, that they are important to us. That in and of itself is helpful. And it doesn't mean we have to be intrusive about it. We don't have to knock on someone's door every day.
Yeah.
But we do need to be mindful that just because we don't hear from people in need doesn't mean the need's not there. And we do need to start looking at what are ways that as in communities, organizations, whether it's a church ministry, an educational facility, a workplace, how can we provide help that's actually helpful? And if you think for yourself as a family, and I myself, cancer's been in my family. I've lost a parent from that horrible illness. And I think about what's actually helpful in those situations. Sometimes it's the most practical of needs. Sometimes somebody needs a ride. Sometimes groceries need to be restocked. Sometimes people have to organize and get things in place, and there's not time to meet those daily requirements. Take care of the pet, take care of the trash, things on a natural basis, and they don't have to be grand gestures. But they're the everyday experiences that we all have to go through. And again, that reaching out, staying connected, and allowing people to still be seen, it's so significant.
If it's one of those things, I think, when you don't hear back from somebody and then, you think, I think there's a lot of internal thought. Did I say something? Did I do something? Did they move on? There's all that dialogue and just reconnecting, because you have no idea what that person's going through. They could be going through, and a lot of times you find out they're going through a really hard time. I have this thing where, like, if I think of somebody a couple times, I'll shoot them a message, because there's a reason why all of a sudden they popped in my head, especially a couple times in a day or two. It's like that second or third time, I'm like, okay, I hear you. And I shoot them a message, and often they're like, oh my God, I was just thinking about you. Or, oh my God, this was such a needed message. Thank you so much. It's like so cool when you do that. But it's people that I've maybe even had that internal dialogue, like, I wonder what happened to them. I wonder. And it wasn't that they were thinking any ill of you at all. They're just going through their own life.
Absolutely. And that stress really can. We are such a busy culture, and there's, it doesn't mean it's a bad thing that we're engaged, but sometimes we do have gaps in those connections and how that can come across. So being able to think about that and not try to put meaning to something that we don't have clarity on is so important. And it's so beneficial to even think of how people might be helpful. There's this whole notion of sometimes there's a discomfort as well. We have this whole notion of we feel like we have to cheer someone up when they're sick. We have to show up in the hospital room with like I mentioned, the balloons, and we want to turn into the clown. And there's this whole notion of, not just singing songs to a sad heart. And what does that really mean to is when somebody's going through something hard, we think it's going to make them feel better if we don't address the topics. We don't ever bring it up. Talk about anything else, talk about the weather, talk about anything, because we don't want to make them feel bad. Well, trust me, they're sitting there feeling bad. And part of what they're feeling bad about is the fact that they have all this information in their mind that is maybe worrisome, or it's painful, or it's difficult. And not that they need the full hour, but they might need someone to check in and say, hey, were you trying a new treatment? Or how's that going? Did you ever have that doctor appointment? I mentioned that, to just even follow up on how they're going through the process, without having to wait for the invitation, thinking maybe they're stepping on toes there. And if somebody gives you an indication that maybe they don't want to talk about it, then that's okay. They can certainly have their privacy. But there's this notion of we don't want to address things that sound hard.
Yeah.
And especially in a social setting, we get together and it's just, let's just keep to things that are enjoyable and fun and lighthearted to talk about.
Yeah.
While there's room for that. There's also room for, again, checking in on someone in their natural state and their need in that moment. And that's that area where I think if we can get past our discomfort, we might have a greater chance of truly connecting and providing that help that's actually helpful.
Do you ever think about even holidays, either in holidays, I've had this in funerals or family reunions or just events where you see people you haven't seen in a while and they're like, oh, we should do this again, other than when, the next funeral or whatever. And then that time passes. Kind of using, since we're in the holidays, you're going to see your family. And especially if you have family members that are going through something, maybe set a time with them outside of the holidays. Use that holiday. I think about because for me, if we're sitting here and having this conversation and we're like, hey, we should do something, I'm going to pull out my phone and be like, hey, let's do it. Let's put it on the calendar. Because if I don't, I know a year will pass and we'll be back again in the same situation. So it's like, let's use that time to say, hey, what are you doing next week?
That whole intentionality. I love that idea because that really does make a difference. We all do that. Isn't that? I don't know how we got into that, but we all learn that process of we should get together more. Don't we say that? We grow up and we believe it in the moment. Yeah. Yes, this would be great. And we don't want to wait to the next moment like a funeral. And yet we allow just busyness to enter in. So if we can pull out that calendar, set some time aside, even if the time set aside is just to make a phone call. When would you be available? When can I check in? I just want to talk to you. I just want to have an opportunity to have a conversation. And we can talk about anything. It doesn't even have to be what you're going through. But that way of allowing people to feel connected. One of the biggest areas of complication and what hinders people's progress, even in therapy and even in their treatment, and what might prevent and create delays in progress, is isolation. And it's that when somebody starts to feel isolated and withdrawn and loneliness settles in, we know that all of the symptom severity tends to elevate. So we want to keep people engaged and keep them socializing. But if they don't feel comfortable reaching back out because it's been a while, that becomes a hindrance. We have to work on that. So if everyone is a little bit more mindful of how that can create to how does it feel to be thought of. And it always reminds me of the old TV show Cheers. Don't you just love the old Cheers? When you can go somewhere and everyone knows your name. And the theme song, why is that so inviting and welcoming?
Yeah.
Because everyone needs that place where they can just walk in, feel accepted, feel as if they're celebrated just for being who they are. And there is such a healing power in that connection. And when we come into the holidays, truly, if you want to bring a sense of joy and healing to your loved one who's struggling right now, give them a sense of being known and being valued and cherished because they are known and they don't have to work so hard at being known well enough that they get your attention. And with our screens, if we can just put our phones down, if we can just get away from the screens long enough to really notice one another, there is such healing power to that.
So literally, I just had a post about that today, and it was from a clip from the episode last week, and we talked about this very thing. And you know, we're especially right now, you're in your screen. There's so much going on. You're busy, and it can be so easy to be in a retail establishment and not even. Like you couldn't pick out the lineup of your barista, like if your life depended on it, you couldn't say what they look like because you didn't even acknowledge them as a person. And we think about the little things of just looking somebody in the eye and being like, oh my God, I love that sweater. Mm-hmm. Like, just a little thing that's superficial,
right?
But just thinking about just opening your eyes and seeing that person and acknowledging them, how little that a long ways that little bit of thing goes.
And just the step of going beyond the courtesy, that social courtesy, or we might extend something, as to your point, we can go through a store, we might go through a restaurant, we might not have that awareness. But if we can get back to that place again, otherwise we're ranking people in terms of priorities and who has value and who doesn't have value. And we're trying to get value maybe through a social media post or something of that nature. And yet there are people surrounding us all over us, including within our homes, within our communities. And to get to that place where we can, again, find that sense of connection. Everybody needs that sense of connection. And we have to be just so careful that we're not brought into right now. One of the areas that's taking place on social media that's such a concern that I'm seeing in my work and other professionals are mentioning as well is this tone of toxic positivity. And what do these words really mean? It's not showing up in our clinical text, by the way, but what it's looking at, and it's something that I'm always cautious that my clients recognize as well, because I have this term comeback in my business name, is that there's this notion that we like to cheer on individuals who've had a hardship and they turn it into some powerhouse return, or that they meet some grand gesture, or that we have to take all hard things and say, oh, use this for your good. There's strength in this. And there can be. But there are times when individuals are genuine victims of abuse.
Yeah.
That there are times when people are sitting there and they're hearing about this fatal diagnosis with limited life expectancy. And we have to be careful how we use that knowledge. And that's the part where I said I was not about to step onto the author journey without having real information that's healing. Because I can encourage and be a cheerleader and root people on, but I want to be careful I didn't misuse. And I didn't misrepresent how those terms work. Because we want people to tap into positivity. But if we're not careful, we're telling people that if they're not having some powerful outcome because they're going through something hard, that somehow they're not doing it right, or they're not doing it well enough. And that just puts people back into that place of feeling shamed or secluded and pressed down. And again, they're going to retreat, they're going to withdraw, and they tend not to even make those connection pieces easy in those moments. And looking at those are things that we can do to even be careful. Like you mentioned, putting a post out there, and how easy is it to us to try to encourage people. Sometimes our encouraging words make the hardships of life sound much easier than they really are.
Yeah. Well, and one of the things the thing I think I loved about our conversations the most is that I like this podcast. I have a whole mantra. I talk about eating faces, right? And I have a whole story behind it. But it's literally persevering in spite of the circumstances, right? And it's like in my life, I've used a lot of motivators or people doubting me and things like that as fuel to overcome those things. And so I'm a big proponent of that stuff. However, because I've been a big proponent of that stuff, because I'm like, oh, you can overcome your circumstances, and because I'm not sitting with a diagnosis that causes me pain, knock on wood, at this point in my life, it's easy to be like, well, don't you just, I catch myself as you're talking, I'm like, oh my God, I do that. Oh my God, like I can catch myself. So like to have that, to me, that's the most important part of this conversation is my growth, because it is like from a mindset standpoint, I'm like, no, just slap up, we can do this. Like, let's get up and go. But no, you're going through something.
Yeah, that whole, we were in this time frame of growing up, and we hear that, suck it up, buttercup. There's this notion of no pain, no gain. And it almost feels like there's this notion of you're weak if you're not. And now, unfortunately, what we're seeing, particularly within especially this whole autoimmune community, that if we go too far the other direction, if we overdo it, and, if we don't have the condition, we might be a little sore the next day, but we can still get up and rally. But if we don't, and we push past, we actually cause further setbacks. And now we're really delayed, and we're having increased inflammation, and any sort of stress, even positive stress, can activate. And when we don't have cure, we're often living in between this balance between what's called a remission or a flare. And anyone who knows that lifestyle, they know they're going to do everything they can to stay out of that flare, because that's hard to treat. It's hard to get back into that state of remission. It can cause further damage. And when you have something that doesn't have a cure, but it has progressive nature, that means it gets worse, not better. So you're wanting to move towards that and stay in that realm of remission, but that's a different way of looking at that exact notion of how do we have this overcoming spirit. And we can still reach great quality of life and peak performance and have wonderful dreams, but we have to look at our reality and look at where we are and what we can do with that realm. And how do we use that language in a healthy, balanced way? Because what might have worked a few years ago, or maybe even for some, and unfortunately right now, there are people today's their day of diagnosis. Today's the day they're hearing that information in the doctor's office. Today's the day they're standing in line at the labs, and they need the individuals in the healthcare community to be good listeners, to have dignity when they want to ask them about private information, and they need to know that there is a way moving forward in that process, and that even if it takes them a while to get back on their feet and move forward, that's not an indictment on them not being that good patient. So how do we look at that? We look at that way of having that support community. And it's okay to realize, oh my goodness, I've been doing this all wrong. I'm saying all the wrong words, because we're all learners in this situation. We didn't know what was helpful or not helpful. And oftentimes we don't know what's hurtful to the people around us because we haven't experienced it. And that's the realm where I mentioned where I often have providers will reach out and ask me for specific information. How do you work with patients who are dealing with chronic illness? What's the best regimen to work with somebody who has this as the reason why they're showing up for therapy? They don't have a mental illness. They haven't been diagnosed with severe diagnoses in the past, but they've just been given this diagnosis, and now they're kind of vacillating in this realm, and they need some support. What's the best strategy? And truly, there are techniques that work well in that area, but it can't just be looked at as a formula. It's not a cookie cutter situation.
You press this button and then press this button.
Absolutely. So I'm always so cautious and recommend where I did additional training in what's called medical family therapy out of Rochester, New York, to gain a perspective of understanding. Again, this is not a new field. I'm not venturing down a path that no one else has ever done. I just found myself in this situation when I first graduated, thinking I would just step into a practice and do this work. I couldn't find anyone else working in this focus area, so I had to venture out and just start it on my own. And I'm still learning in that process, having to take on that task again. I'm right now doing research to write a book. Right, that was the whole purpose of what I'm doing. And yet, now that I'm in those trenches and realizing there's so much that we can all learn from it, so that even family members can feel more successful, and friends to support those around them that are going through something hard in transitions. And we have an entire population right now, a growing number of aging parents. We have a growing number of patients dealing with dementia and Alzheimer's, and there are changes coming into people's lives. And really, people need to have some guidance and support so that they too know how to be good helpers in those situations as well.
When is the book coming out?
It's a work in progress, and that's been the theme of what I used to speak about all the time, and just bringing those sense of awareness. And you mentioned how you've even brought things that you've struggled with and how that kind of brought change. And for myself, it was something that I didn't really think about much when I was going back to school or working with people in pain. But one of the really painful life experience for me happened when I was in my late teens. I don't even think I was in my 20s yet. And I worked for a company that was very passionate, very loyal to for years. And it was a year that every year, naturally, everybody got a promotion. We all got moved up a notch and we got into this place. And one particular year, we got our assignment sent to us, and I didn't get that promotion. I was failed to get the promotion, and everybody else did. I was the only one who didn't get the promotion. And I was looking at this, trying to find reason and cause. So I reached out and I spoke to the boss, and I expressed concerns and asked for details. And I was told, oh, you were just put in this new position. Now you get this new responsibility. It has a different title and all this information. I'm thinking, but I already had that new position. It's a whole nother level of work, and I'm doing that too. Why wouldn't I have had the natural progression? And a really good friend of mine that worked in the company that was a couple of years older, so she had a different role. She pulled me aside privately, and she says, I have to tell you this. She says, I was told directly by the boss the reason you didn't get the promotion is because she said you're sick all the time. And for me, I hadn't experienced something like discrimination for being ill. And back then, I was experiencing regular migraines, and we didn't have good treatment back then. Honestly, they gave me Tylenol. That was my treatment. Yeah. And I have a pretty severe form that I have very frequently, and that was enough. And I recall a few moments where my boss actually tried to use some counseling techniques, some imagery to talk me out of a migraine when it first started, as if I had the power or control to do that, which I don't, and to this day, it still doesn't work in that way.
Okay, show me some imagery and take away that headache.
As if that was something I had a choice over, control over as a kid. And yet that realm of recognizing, and I just kept that information to myself private. I didn't know what to do, but it taught me that illness has a shame, and that is a form or a source of discrimination. And I didn't want anyone else to experience or to feel that. And to this day, and sometimes I'll even stop and I'll think back on that. And I realize, what's really unique is, and then years later, I was diagnosed with another really significant condition. And she herself has that very same condition, but she didn't know I had it, and it didn't seem to matter. But the fact that we could discriminate against others because of an illness, where it's not by choice.
Yeah.
And recognize that, trying to relearn that label. So trust me, a big part of a chapter in this book is looking at this notion that, while there might have been some accuracy, I was sick. I was sick frequently. But now the truth of it is I'm always sick. And maybe that's not a bad thing. Maybe we can be sick and we can still be productive. It didn't cut down on the quality of the work that I provided, but it certainly limited my opportunities if the right perspective wasn't seen to show support. And nowadays, I'm always so grateful when a parent calls and I have an opportunity to work with a kid, or I work with an adolescent or a young adult who's saying, I have this diagnosis and I don't know how to go forward with that. And they're worried about the same things. And that's where that piece where I have a little bit of vulnerability where I will share with them. I too live with that type of diagnosis, so that they don't feel like there's not an opportunity for moving forward.
You give hope.
That's the goal every day. That's what I'm hoping to provide. And I think that's part of what brings a different level of healing that motivates individuals to keep increasing that quality of life and connection.
Kristina, this has been a phenomenal conversation. Thank you so much for coming down, sharing your difference, and just educating. It was really educating. It's cool that you started off as an educator, because there's so much knowledge you dropped, and I think it's going to make a difference.
I certainly hope so. I thank you so much for the opportunity. Really, it's a work in progress all the way through, and I really do plan to do writing, and I really do plan to get back into that speaking role. I just know that for myself, the audience, the whole point of it is I want people to find that sense of hope and find that connection in that full realm. And it's not just through that one avenue or through that one venture, but truly it's about just seeing that humanity in good progress and finding that sense of their faith and using that in the right ways, not against one another, but for one another, so that there really is an opportunity for all people to experience that peace and hope.
It's that empathy again. Going back to how much better of a place would we be if we could just open our hearts and have more empathy and just have an understanding of what's that person going through. Exactly.
Because life can be hard. It can be beautiful and wonderful and exciting and all of those other things, but there are also hard moments. And that's that place where we don't want people to get lost along the way. And I imagine anyone can probably think back and even just pause for themselves, and they can think about people along their path or their journey that right now there's probably someone that comes to mind thinking it's been a while since I've heard from them, or it seems like they went through something challenging, or I think maybe they have gone through something, and just a check-in. How are you doing? Yeah. Gosh, let's get together. Let's get together for a coffee. Let's just sit down and talk. I just need to see you and talk to you. And the fact that we know shows a progress towards connection and healing, it is so valuable and so achievable. We don't even have to go back to school to be able to extend that invitation, something we're all already capable of doing. We just have to be intentional. That's very true.
So I have my people in my mind. I'm going to reach out to in the next couple of days in my challenge to anybody listening. Who are you going to reach out to? Who do you have in mind? Who's someone you haven't talked to in a while? Who's someone you know that's probably going through a hard time? Who would you really change the trajectory of their day if you reached out and just asked, how are you doing? And it not be the superficial.
Absolutely true. And you referenced a parent with a difficult diagnosis, and just recognizing when we go into holiday seasons and changes in traditions. And for some, it's people are going into their last holiday seasons with family. And that in and of itself just brings a different level of, we can feel that heaviness. We can feel that grief. We want to maximize that time together. And that just shows just so how powerful those connections really are, that if we can just be mindful, because everyone's experiencing something along that line, whether it's a change in a relationship, it could be a life's journey is coming close to an end. For some, it's a loss of employment. For some, it's a loss of hope in a relationship. There's so many ways that we can really tap into that power of what does it mean to truly celebrate the significance of Christmas or holidays or experiences that our families come together that meets that need on a different level. So I will be certainly encouraged to know that you can be reaching out to people in your family, and I hope they do the same for you as well.
It's I think it's that pay it forward, right? I think I know whenever I've done this, whenever I've reached out to people, it kind of happened. Other people do it. Just kind of like spurs other people to do the same thing. So I hope it does. I hope it can take off.
There is that ripple effect.
It's a ripple effect, yeah.
It really is. And ideally, that would be the same thing when it comes to things like mental health and behavioral health and emotional health, that there could be a positive experience with that ripple effect. Because all it takes is, any of us can turn on our news channel and we're going to hear about individuals who are truly suffering, and people can look back and see that there's been struggles going on for years and years and years, and people have had a need for help. And oftentimes there's a lot of commonality where people will say, yes, let's get that person some help. And then I often will I kind of stop and kind of pause in my tracks and realize when people use that reference, so-and-so needs to get some help, they should get some help, that always sounds so punitive. That always sounds so negative. Yep. And we undervalue the fact that yes, people do need help, but everybody needs help. And you can think about the ways in which if we just had that sense of connection and awareness, and we open our eyes to those needs. And I know there are some wonderful things taking place. Educators doing wonderful jobs right now of teaching that empathy, teaching those skills so that people are being valued, even in very early elementary grades, and moving that all the way through, which is so valuable. And parents who are doing that, and coaches that are doing that. And in churches, there are so many organizations right now who are doing good work in that area, and just to be reminded and to be encouraged to continue to do those good works, even if it's, it sometimes gets put on the back burner compared to some of the other messages out there, especially in the social media. But people do have a need for that, and gratefully there are people who are still doing that and need to do more.
Thank you again, Kristina, so much for coming down. And we mentioned your husband, Stephen, a couple times. Stephen, thank you so much for saying, hey, I have someone that needs to be on the show. This has been awesome. Thank you.
Thank you.